Medical jargon versus common language, bridging the gap in healthcare communication. Good morning, everyone. Today, let's talk about medical jargon, the specialized language doctors, nurses, and healthcare professionals use, and how it differs from the common language we use in everyday conversation. Understanding this difference is crucial because effective communication in healthcare can literally save lives. What is medical jargon? Medical jargon consists of technical terms used by professionals to discuss symptoms, diagnoses, treatments, and procedures efficiently. It allows for precision, but it can be confusing for patients. For instance, if a doctor says, "The patient exhibits tachycardia with acute dyspnea due to myocardial infarction," most people might struggle to understand it. But in simpler terms, it means the patient has a fast heart rate and difficulty breathing due to a heart attack. Why does medical jargon exist? Jargon helps medical professionals communicate quickly and accurately with each other. In emergencies, a short, precise term can make a huge difference. However, when speaking with patients, using too much technical language can lead to confusion, anxiety, or even misunderstanding about their health condition. Common language in healthcare. Common language is what patients and non-medical individuals use when talking about health issues. A doctor saying, "You have hypertension," might be unclear to some, but saying you have high blood pressure makes it more understandable. Here are a few examples: medical jargon, edema, common language, swelling. Medical jargon, fracture. Common language, broken bone. Medical jargon, febrile. Common language, has a fever. The importance of clear communication. When doctors use too much jargon, patients might feel uncertain or afraid. Imagine being told, "You have a malignant neoplasm." That sounds intimidating. But if the doctor simply says, "You have cancer," and explains the next steps clearly, it helps the patient process the information with less stress. Bridging the gap. Doctors and healthcare professionals must learn when to use technical terms and when to translate them into common language. Patients should also feel encouraged to ask questions when something isn't clear. A simple, clear explanation builds trust and ensures patients understand their condition and treatment options. Final thoughts. Medical jargon serves a purpose, but in patient care, clear communication matters most. Whether you're a healthcare worker or a patient, bridging the gap between jargon and everyday language can improve understanding, reduce anxiety, and lead to better health outcomes. Thank you for listening. And remember, next time you hear a confusing medical term, don't hesitate to ask for a simpler explanation.
After watching the video, there are 5 questions you need to answer. Firstly, why do medical professionals use jargon, and how does it benefit communication within healthcare teams?
Thank you. In my opinion, medical jargon helps professionals communicate efficiently and accurately. It allows quick decision-making in emergencies and ensures precision in diagnoses, treatments, and procedures.
The second question is, what challenges can arise when medical jargon is used with patients, and how might this impact their understanding of health conditions?
Thank you. Well, patients may feel confused, anxious, or overwhelmed if they don't understand technical terms. Miscommunication can lead to misunderstandings about treatments, causing fear or even mistakes in following medical advice.
3. How can doctors and healthcare professionals improve communication with patients while still maintaining accuracy?
Thank you. Well, they can simplify jargon, use common language, offer clear explanations, encourage questions, and use visual aids to ensure patients understand their condition and treatment plan.
4. Why is it important for patients to feel comfortable asking for clarification when they hear unfamiliar medical terms?
Thank you. Asking for clarification helps patients fully understand their health, make informed decisions, and feel more confident in their treatment. It fosters trust between patients and healthcare providers.
5. What are some examples of medical jargon that could be confusing for non-medical individuals, and how can they be translated into common language?
In my opinion, examples include edema, swelling, hypertension, high blood pressure, myocardial infarction, heart attack. Using simpler terms ensures patients grasp their condition without confusion.
Thank you for taking the time to answer all of these questions so thoroughly. Your insights are truly remarkable, and I appreciate the depth of understanding you've brought to each response. It's been a pleasure engaging with such thoughtful discussion.